Alright, today we're going to be doing a step 2 style question, specifically surgery and trauma, so stay tuned for the answer. A 27-year-old man is brought to the ED after being stabbed in the left upper abdomen. He is alert and oriented. His vital signs show a blood pressure of 88/54, his heart rate is 128 beats per minute, and his respiratory rate is 22. On exam, he has diffuse abdominal tenderness with guarding. Breath sounds are normal, IV access is obtained, and fluids are started. Which of the following is the best next step in management? So the main thing we want to pay attention to in this question are the vital signs. His blood pressure is 88/54, so he's hypotensive. He has a heart rate of 128 beats per minute, so he's tachycardic, and he's hyperventilating at 22 breaths per minute. In the question, we can see that the patient was stabbed in the abdomen, so he has penetrating abdominal trauma, and now we have to find out what's the next best step in management. So let's start with A, FAST exam. The FAST exam stands for Focused Assessment with Sonography for Trauma. Basically, this is a quick ultrasound, and it's great for unstable trauma patients when you're not sure where the bleeding is coming from. But in this patient, we already see penetrating abdominal wound. We see signs of peritonitis, where the patient has abdominal tenderness and guarding. He is also hemodynamically unstable. Therefore, this combination tells you that there's an abdominal injury, and you don't need to do an ultrasound to check where the bleeding is coming from. Automatically, we can take him to surgery. Now, as for B, CT abdomen and pelvis, this is automatically incorrect. When you have an unstable patient like this patient with his vital signs, you never want to take them to CT because taking them to the CT requires moving the patient from one room to the CT room, and they don't have that much time, so you want to think quick. It's not the most optimal decision in this situation, therefore B is incorrect, and it's usually incorrect for anyone that's unstable. Now for choice C, immediate exploratory laparotomy. This is the correct answer. This patient meets the criteria for going directly to the OR, having surgery done on him. He has penetrating abdominal trauma from the stab. He has peritonitis, he has a rigid abdomen and tender abdomen, and he's guarding. And he's also hemodynamically unstable. Therefore, laparotomy in this situation is diagnostic and both therapeutic. Therefore, this patient needs to be taken directly to the OR, and this is the correct answer. As for D, diagnostic peritoneal lavage, this is incorrect, and it's usually incorrect when asked in a question or when it's an option. DPL, it's an old school and rarely used step anymore. It's only used when FAST is not available or FAST is inconclusive. Therefore, it's not usually the answer, and usually you want to sway away from this answer if there's a better one in the question. And last but not least, we have extended FAST or EFAST. This is basically the same as option A, however, it adds the evaluation of pneumothorax and hemothorax. But again, this is unnecessary because the source of instability is coming from the abdomen. That's where the stab happened. And he has peritoneal signs. He's guarding. He has abdominal tenderness. So you don't need more imaging. You need definite management in the situation. So the best option is C here. E is incorrect. You want to take him to the OR immediately, especially with signs of peritonitis and especially with hemodynamic instability. Thank you so much for watching this video. If you enjoyed, follow our page. We also have YouTube and TikTok. Follow us there too. Thanks so much.